October is National Breast Cancer Awareness Month, an important time to recognize the disease and how to prevent it. But breast cancer is not the greatest threat to women's health. The #1 killer is actually heart disease. Dr. Kevin Campbell here this morning with more. He actually wrote a book about this. We'll get to that in a moment. Doc, good to see you.
Good to see you, Phil.
What do folks need to know this morning about heart disease?
Heart disease kills more women than men. Heart disease is the #1 killer of women in the U.S. today. However, women are undertreated and underserved. They're less likely to have advanced procedures to treat heart disease, and they're often sent home from emergency rooms when they present with symptoms because their symptoms may be a little different.
Sure. As we mentioned, you wrote this book here. It just came out on shelves recently, right? Or is it out yet?
It's going to come out this week.
This week, okay.
And be available then.
Women and cardiovascular disease. What's in it?
So what we're talking about in this book is really telling folks what the problem is in the U.S. and in the U.K., really examining why that problem exists, and then I offer suggestions of how healthcare workers as well as patients and women and families can do things to really improve their own cardiovascular health and kind of close that gender gap so that we can reduce the risk of heart disease in women throughout the U.S.
Of course, we want folks to check out the book, no doubt about that, but what types of tips can you give this morning to women out there?
One of the most important things that I can offer to women is that you need to engage in your own health care. Understand what your risks are, such as diabetes, high blood pressure, smoking, kind of a sedentary lifestyle, family history. If you have those risk factors, make sure you see a healthcare provider and really push that healthcare provider to screen you for heart disease and then modify your risk factors. We have to engage women in their own healthcare to improve outcomes.
Yeah, we should also mention this is your specialty. I mean, you are a heart doctor, so I know you talk about everything with us, but you are a specialized heart doctor.
And this is my passion. My daughter is my inspiration for this book because I have a 13-year-old daughter, Beck, who I don't want to suffer from heart disease. And I want to make sure she takes control, my wife takes control, and healthcare providers know all about what to do for women.
We don't want anyone really suffering from this at all. Doc, good to see you.
Good to see you.
Of course, if you have a question for Dr. Kevin Campbell or you want to check out his book, log on to our website, WNCN.com. Check links we mentioned. From there, you can find his website or you can like his Facebook page and his Twitter. And folks can also check out the book through your Twitter as well, right?
Correct. Absolutely.
There you go.